Hi, it's Dr. Rob for Jefferson Health with medical news you can use. It's the season of influenza. There has been a health alert that has been issued by Philadelphia. Why? Because this area and in Pennsylvania, certain areas, flu activity is really increasing. And there are things that you all can do. Number one, please get the influenza vaccination. You might say, well, it's kind of late in the season. No, influenza season can last anywhere from early October through May, and depending on the year, it might start earlier and last longer. Between 5 and 20% of the population gets affected by the flu each year. And while the flu, for most people, you get over in maybe 5 days to 2 weeks, it can cause serious illness and even death for people. Those 65 and above, and children 5 and below, especially those less than 2, are at highest risk. So what are the symptoms? Well, flu tends to come on pretty quickly. You may be feeling fine one day, and maybe you're around someone who's coughing and sneezing, and within 1 to 2 days, you start feeling pretty ill. You might have muscle aches, joint aches, everything hurts when you walk. Fever. Now, not everyone with the flu gets a fever, but some people do. And some fevers are 104 or even higher. This unusual fatigue, cough, sore throat, this headache. Once you get the flu, what can you do? Please stay home from work. Also, if you can, have a sick room in your house where that's where you're at. Family members kind of avoid you while you're sick. And then, hopefully, within 3 to 4 days after you've had the flu and starting to feel a little bit better, you're not as contagious at that point. If you're around someone with the flu who's coughing or sneezing, you can actually get that. Why? Because particles, this is a respiratory virus, can travel about 6 feet from the person who's sick. And even if they're just talking, these particles can go towards you and you can breathe them in and they go into your lungs. So that's why you want to be really careful about being around people with respiratory illness. And if you have one, that's why you want to stay home or away from people until you're feeling better. If you have had the flu shot, you can get the flu. It's not 100% effective, but it can decrease the risk of severe illness, such as perhaps inflammation around the heart, inflammation around the brain, pneumonia, ear infections, secondary sinus infections. So there are other type of infections can develop when your body is battling the flu. If you happen to get the flu, try to call your doctor, because within 48 hours or so, we have medications that can help you decrease the severe symptoms of it and hopefully help it to resolve a lot earlier. Red flag signs for the flu. Okay, for children, a fever greater than 104. If all of a sudden they're refusing to walk or have difficulty walking because of the muscle pain. If they get confused, a little bit disoriented, stop urinating or decrease, those are red flag signs. For adults, difficulty breathing, fast breathing, chest pain, confusion, severe headache. Adults with a fever greater than 103 or 104. Please, if that happens, these are red flag signs. You want to talk to your doctor or just go to the emergency department. While the flu, most people do well, these red flag signs are saying there could be something else going on and you want to get it checked out. So I hope you all get your flu shot, talk to your healthcare provider, and I hope you all have a safe and healthy winter season.